is Dr. David Kay. I'm a chiropractor here at York and Viaduct, and from the title of this video, you're probably interested in what you can, in knowing what you can do about your back problems and what has caused them. Before I get into it, just a bit of background on me. I'm a chiropractor. I used to be a pipe laying contractor after I finished the science degree, and so I understood what it was like to have this terrible back pain that would afflict me from time to time and often put me off work, and it was pretty uncomfortable when I was doing things like wakeboarding, fishing and skiing. When I got older, we've got children at the age of 5 and 10, and lifting them into the car seats, that can sometimes be a problem for people. But the big affliction these days is people sitting at their desk for long periods of time. Anyway, I won't keep you too long. I want to run through a few things that we see on a daily basis in our office and what we can do to help them out. Righto. So the first thing we've got to understand is there's a couple of things we need to know about the spine, and that is that it's comprised really of a whole stack of bones, one on top of each other. We call that the spine. And so with that, what we've got here is two of these bones. So we've got the spine that sits like this, facing the front, at the back, and all of these bones are stacked upon one each other, and there's also, through the middle of it, is the spinal cord itself. So what I've done here, I've taken the liberty of drawing a bigger diagram here, and so if you can imagine, this is one of those bones, okay? And let's call this fella here L3, because that's the third lumbar vertebrae, so right down the back of your spine, and that fella there is going to be L4. That makes sense. And guess what's below it? That's right, L5. Anyway, with this, what we understand is there's also between each of the bones, we've got what's called an intervertebral disc. Now, if you've injured a disc like this before, you might know the pain associated with it. That might be pain down your legs, it could be poor flexibility, you might have even been prescribed injections into the spine, or you might have even been recommended to have surgery. If you've been down that path, you know exactly what we're talking about here. And so what sometimes happens is the disc into the spine, okay, we've got this disc here which separates these bones, keeps them apart. Sometimes that can bulge backwards into the spinal cord. And the spinal cord's this red thing that sits back in through here. Now, where that becomes a problem is if we've got the brain sitting up here and it's talking to the legs or different organs down here, or as it's more accurately, talking to it via a nerve, and we've got this pinched or it's been squashed, what's going to happen is we're going to get sometimes pain, we sometimes might get pins and needles, and we sometimes might get tingling or weakness. Now, if you've experienced this before, you know exactly what I'm talking about. So that can be one of the causes of pain. The other one could be over a long period of time, if we've damaged our back and we've got a disc that's bulged out, or we've had falls or accidents, then what can happen is over a period of time we've got these spurs that can sometimes develop on our vertebrae, and if you look at these, they look a little bit like the beak of a bird, okay? And these little projections here are what we call arthritis or arthritic spurs. Now what these can do is they can just lock down and stabilize the spine to the point where you don't get any movement. Typically not associated with too much pain. However, what it can do is limit the movement dramatically. And you think about it, your parents or your grandparents, they might move like this to turn their neck, or they might move in a shuffling movement to move their lower back. That's where this arthritis becomes a problem. So that's our second one. The third one is, if you can imagine, all along our back, we've got these big, red, meaty things. What are they likely to be? You've guessed it, they're muscles. Now these muscles are pretty important because what they do is they help us move, they help us stabilize our spine, and they help us stay strong and upright. Now, if we strain one of those muscles. Say we've been lifting our kids into the car, if we've been, I don't know, with a crowbar just into the ground like I used to be, or you might have been an athlete or a sports star that you've dived for a try, or you've intercepted a pass playing netball and you strain that muscle. So that can be one of the causes of back pain as well. And finally, for the mechanical side of things, is between these bones and working pretty closely with the muscles are ligaments. Now, when we've got ligaments between this area here, they can get what's called sprained. And anytime there's ligaments that are sprained, muscles that are strained, discs that are inflamed, that can release chemicals in your body. We call them prostaglandins. And what they do is they act on the nerves, and that causes that pain and discomfort that you might be experiencing. Now, if that's you, you might go, yeah, well, what's that got to do with what you're talking about? Well, it's really super important, because if we've got joints that are inflamed, irritated, chronically not working like they should, what that can lead to is, I guess, degeneration, which we've got over here, which is these spurs and that arthritis. But it can also mean that these tiny little joints into the spine, okay, I'm going to show you close up. So we've got little joints at the back of the spine here. If they get irritated, it's a bit like having a stone in your shoe. So if you've got movement in through there that's been limited and this part of your spine is irritated, that can cause inflammation around there as well. And so what my job really would be is to identify what's causing that inflammation, and we'd like to do that with, I'd suggest x-rays would probably be one of the best things to do. So if you're ever going to look at having your spine looked after, make sure they have the x-rays taken of you. And we'd be taking some pressure off that area. We'd be giving some space, taking the pressure off that nerve. We've got to make sure that that nerve there's got enough, I guess, area around that opening for it to move without irritation. Because it's not only that nerve that causes irritation, it's the inflammation around the joints, it's the inflammation of the muscles, and it's the inflammation of the ligaments. And so what do? Well, we want to make sure if we were ever going to look after you, we'd be making sure that your spine was assessed properly. We'd take you through a full range of movement, flexibility. We want to see where these nerves might be irritated. We want to see where these joints might be inflamed or irritated. We want to find out where these muscles are irritated. That's a really big deal. And of course the ligaments. Now the ligaments are some of the things that we think of the least, but when they get stirred up, they're very, very slow to heal. As is cartilage. Very, very slow to heal because the blood supply is not great. And so what we want to be doing, we'll be doing a few things. We'll be going, well, the first thing we want to do is what we call an examination, okay? We want to examine your spine. First and foremost, we want to examine it. Because without examining it, we've got no idea what we're talking about sometimes. The second thing we want to do is we want to review x-rays. Now, why do you think we review x-rays? Yeah, that's right. It's so that we don't miss out on anything, because a picture speaks 1,000 words. So we want to have a look at the x-rays. And if we've got soft tissue injuries that are chronic, or you know full well there's a bigger problem, or you've seen somebody else, we'll be looking at MRIs, okay? Because they give us a really good picture of what these soft tissues look like. Now the third one, and possibly the most important, would be to ask you questions. How did this happen? How did you find yourself in this position? What have you done for it up to this point? How's this interfering with your life? Because if you can answer those questions, or we can help you answer those questions, we set a program to make sure that you get exactly what you want. And so we're asking questions. And this is the key. So we're examining, we're reviewing x-rays, we're asking questions. And the final step would be, we come to a conclusion as to what we need to do. We do it with you, we agree on a plan, and we execute it. So that's what we're doing, our 4 steps. So we're going to work out what the problem is, we're going to examine you, we're going to look at the x-rays, We're going to ask you questions as to how it happened, what you want to get out of it, and then we make a plan. Because everybody needs a plan. They need a roadmap as to what to do. But this is not for everybody. You see, this is for people who actually want to look after themselves. Because coming up with a plan sometimes takes time. And sometimes it takes money. And sometimes it takes work, hard work. You're doing exercises at home. You're doing strength and conditioning work at home. That's where a lot of people come unstuck. Because they don't want to invest in themselves. So this doesn't work for people who want me to do all the work. It doesn't work for people who think they can sit back and just get better by themselves. It doesn't work for people who want an overnight solution to a problem that's been there for yonks. And it doesn't work for people who put all the onus back on the practitioner to give them the best results. And that's where it comes unstuck. Who we like looking after though are people who really want to invest in themselves. They go, you know what, this has been here a long time. I need to put some money into this. I need to invest my time. I need to invest myself in this process so I can get the best result. And that's the sort of people we want. In fact, we don't take anybody else. You know what, I'd like to invite you. If you're in the Auckland area, we've got two practices, one in Remuera and the other one in Auckland Viaduct. If you're in that area and you have experienced this horrendous back discomfort, chronic back pain, sciatica, leg pain, disc prolapse, why don't you just get in touch with us? Just fill in your name and email address, get in touch with us, and let's just see if what we do can help you. The worst thing we can find out is we can't help you, and we'll probably point you in the direction of somebody who can. Because what we know is injections into the spine, surgeries if needed, and medications which are pop like lollies are possibly the worst things we can be doing for ourselves. We want to make sure we're doing things free of medication. We're free of surgery. We want to make sure that you can do whatever it is that you want to do from this day on. So if that sounds like you, I invite you, get in touch with us and we'll see what we can do to help you. My name is Dr. David Kane. Hopefully you know a little bit more about back pain. I love doing these sort of videos because it freshens my memory on how we look after people and how we get the best results. Anyway, leave some comments below, get in touch with us if it sounds like you, and we look forward to seeing you at our office.